that consists of a acute respiratory virus, which is rapidly spread, a virus with no verified treatment, a virus that does not yet have a vaccine, and a virus that hits all of society indiscriminately, all sectors of society. In some, it spreads more rapidly, and in other parts of the population, it is highly lethal. To face something of this nature, the world had no handbooks, and no country was sufficiently prepared to face these conditions. We know that this pandemic brings serious social and economic effects, because to face up to its exponential growth, we've had to take draconian measures which lead to preventive isolation of almost all the population, closing borders, stopping large gatherings, stopping trade. And these consequences of facing the pandemic are being felt. We see it in unemployment, poverty, in a fall of trade activity. But without doubt, this exceptional situation is putting us before the great challenge of our history. There cannot be a dilemma between the protection of health and life and social and economic development of our countries. So the work we have to undertake together is to protect health and life and at the same time beat coronavirus. And we win insofar as we have distancing, discipline, collaboration and generosity, to the extent that we take public policies that are focused properly and that we're able to undertake testing that we can trace, and that above all that we set up a good culture amongst our citizens. So we have to face this pandemic with optimism, and that means that we have to do so with respect over its lethal nature, but also bearing in mind that if we are sufficiently disciplined and we work together and we are sufficiently joined, we'll be able to face this with success. That's what we've tried to do in Colombia. We've taken difficult, drastic decisions, but this has helped us to ensure that the number of deaths per million inhabitants in our country is favorable. We have also been able to see that the measures for the protection of sectors which have greater fatality rates have meant that we've been able to improve our capacities, and we've been able to widen our intensive care services, and we've been able to help the health sector to face the ravages of this pandemic. Of course, we are aware that we have other challenges, the challenge of reactivating the economy, protecting the most vulnerable, and influencing through teaching so that we all behave in a better way. This is the major challenge of our times. And I believe that the World Health Organization is called on to ensure that within multilateralism, all of us make our efforts so that we don't think as individuals, but we work as a major collective, so that we develop rapidly a vaccine and that we find treatments and we have serious and rigorous epidemiological control, so where we work with science as our ally. Because I have no doubts that when we live with this, we might understand that Mother Earth is speaking to us, and that we must think about not returning to how we were before, but that we come out better as a society, where we understand that protecting health is a fundamental right for all, and where the linking and working together of all governments will make the difference. And that's why I call on the World Health Organization and all the member states to face this COVID-19 with a better sense of international cooperation in order to protect those who most need it. Thank you. Thank you very much.
Thank you, Your Excellency. We are pleased to have with us His Excellency President Mario Abdo Benitez, President of the Republic of Paraguay. Excelencia, le doy la palabra.
Señora Presidenta.
Thank you, Madam President of the Assembly, Member States. Director General Dr. Tedros. This year, 2020, is no doubt going to be remembered as a turning point in the history of mankind. A year in which we had to face a pandemic which forced us to evaluate and re-evaluate what we are, how we live, our families, our countries, everything. This is one of those challenges that comes along occasionally in life, but which makes us grow in the end. Yes, the coronavirus is difficult and will be difficult for everybody, but it might also help us to improve as a race and a society as we have to take these very difficult decisions which are going to face us now. We've certainly been trying to do that in Paraguay. Once we had 2 positive cases registered in our country, we took a decision which some people at the time found to be over the top. However, we knew the situation on the ground in our country, we knew our people, and we knew the position of our health system. And we also had the opportunity to look at what was happening in countries where the pandemic was already more developed and which yet had great capacity in their health systems. And we saw that they had found it as difficult as we were otherwise going to find it to be ready to tackle the pandemic. Yes, it was drastic to close down schools, to shut borders, and put many, many people into quarantine, but that was what our strategy was. We took a decision which we knew, as I say, was going to have a major impact on and for our people. But at the same time, it convinced them of the need to obey the health-related instructions they were being given. No decision that we took actually would have had any effect at all unless we had united support behind us offered from our people. And that's what we had. Our people understood how difficult the situation was. They were supportive, they were disciplined, and they were even enthusiastic in following the orders and instructions that we were issuing. That in itself has meant the beginning of a change to a different way of living. It isn't easy, I can assure you, to tell your people that they can't come back to their own country unless they follow instructions. COVID-19 put us in a very difficult position. We had to say to our people, sorry, you're going to have to wait where you are, you can't come home yet. We saw what happened, that this situation ended up separating children from their parents, the child in one country, the parents in another, and it's not easy to issue instructions that lead to that. At the same time, although of course we saw objections, we also saw the mental strength and resilience of our people being demonstrated. This pandemic has also put us, some people think, at a crossroads, one where leaders have to determine which road to take, the road to promote health or the road to protect the economy. Actually, you have to go in 2 directions at once because you have to do both. And that's difficult for leaders too. What we've tried to do is provide protection and support to the poorest and the most vulnerable in our country. We've given subsidies and financial assistance for a certain period of time to at least 60% of them. We've tried to continue with public works which can give people jobs, carried out, of course, in conditions of strict social distancing, and I'm happy to say that we haven't seen a single case of COVID-19 transmitted in that particular sector. The same is true of agriculture and food production. We have to guarantee food security, so we were unable to close those down. That was another difficult decision to take, and I repeat, we took the decisions, but we knew they wouldn't work unless we had support from our people. Fortunately, we got it. People not only supported us, they supported each other. They held out a helping hand to those who desperately needed it. I'd like to express my recognition, my gratitude, and my admiration to the ordinary citizens of our countries, the emergency services, the health workers, and all the unnamed people who realized that people around them were worse off and in need and were happy to take their last piece of bread and give it to them if necessary. Despite the physical distance that has to separate us for the time being, we've managed to remain close by using creativity and technology, and in the midst of so much tragedy, we've managed to realize, I think, the value of things as simple as a handshake or a hug, things that we used to take for granted, things that we used to really not notice when we did them automatically, and now we can't, and they've taken on a great deal more importance. We've also realized, I think, that all of us are equal. The virus certainly thinks we're all equal. It's taught us that, and it's also taught us that all of us can do something to help all of us find a solution to the problems we now face. We've learned that we're not in isolation, even if you see what I mean when we are, that we're all components of a whole. What we do affects our neighbors, changes the lives of families, and if we don't do it right, can cost lives. If we do it right, of course, it can save them. We've understood that a global challenge, a global disaster requires a global response in which all nations participate, and as they participate, put the value of human life right at the center of whatever they're doing. What we do now will be remembered and re-evaluated by future generations. That's something important to bear in mind. We have an opportunity now, once and for all, to learn the lessons involved in this situation and not go backwards once the situation is over. What we need to do is go forwards, rebuild the world, build a better world, a stronger world, a more resilient world, and a more decent world where we have the proper value placed on health, health services, and the individual. Once we have those things, then we'll be able to do a better job of preventing and dealing with future disasters, disease outbreaks, and or climate change. When the children of our children sit in their history classes and study this chapter of the human race's existence on this planet, what we want is for them to remember that the best decisions are the decisions that people take when they respect the right values. If they do that, then we'll have healed a lot of people, a lot of societies, and the world as a whole. Thank you very much, and God bless.
Excellency, I would like to mention that your country is currently chairing Mercosur. I shall now invite the Prime Minister of the Kingdom of Bhutan, His Excellency Dr. Lotai Tshering, to make his statement.
Madam President, Ministers, and distinguished delegates, greetings from the Himalayan Kingdom of Bhutan. I have the honor to convey best wishes of my King, our Queen, and the people of Bhutan. As a medical professional, I am always overjoyed to be interacting with the health fraternity within the country and beyond. We are living in an extraordinary times as we all deal with the crushing weight of this pandemic. But as much as there are challenges, we are inspired by the incredible stories of kindness and bravery of our healthcare workers across the globe. I would also like to offer my deepest condolences to everyone who have lost their loved ones to this pandemic. For Bhutan, we always believed that a nation can only grow on strong foundations of a good healthcare system. As the pandemic came closer to us, our preparations resolved around the comprehensive healthcare system Bhutan always had. For decades, alongside education, our kings have always ensured free and quality healthcare for all Bhutanese. And in times like this, we are once again asked to reflect on the efforts and importance we have placed on public healthcare system, mainly the universal health coverage for all. Such pandemics are a bitter reminder that healthcare system of a nation determines that of the entire globe, which is why it is time for leaders to come together and discuss global health problem as a common objective. This is where I see WHO taking a strong lead in redefining our approach to global healthcare system. We are grateful for the timely support from Southeast Asia Regional Health Emergency Fund. I am particularly happy with the efficient leadership of Dr. Poonam, the Regional Director of CRO WHO and our WHO country office in Bhutan. We are very fortunate to have our kings who have always emphasized on the importance of free and quality health care for all. And now, His Majesty the King is personally spearheading the combat against the disease. All the 21 positive cases that we have until now are picked up from the government-sponsored quarantine facilities. We ensure strict surveillance and testing during the 21 days mandatory quarantine period. But again, we are not compromising on our preparations should we experience a local transmission. I understand it will be a while before we come out of COVID-19. Here I would like to urge the participants to discuss measures to ensure that more vulnerable countries continue to have access to diagnostic tools, PPEs, drugs, and of course the vaccine when it actually becomes available. As we put all our resources and energy behind COVID-19, let us also remind ourselves not to compromise on the routine health services. We may not realize now, but what if the damages on other health conditions like NCDs, infectious diseases, and vaccination programs become unmanageable when COVID-19 recedes? This is equally worrying. That is why my government is always reminded of the routine health services as we combat the pandemic. Like all other governments, we are put to test by this pandemic. But Bhutan, although resource constrained, will do our part. As I end, I would like to share my King's concern that this health crisis has already put immense burden on our economy, and if you are not mindful and strategic, it could create social disruption. In anticipation of such challenges, let us all work together to avert such crises, just as fighting COVID-19 requires all of us to work together. I look forward to your cooperation. I send prayers for my King and people of Bhutan. Thank you very much, and Karinche.
Thank you, Excellency. J'invite à présent son Excellence.
Now I invite His Excellency Pedro Sanchez Perez Castejón, the President of the Government of Spain, to take the floor. Your Excellency, I give you the floor. Ladies and gentlemen, I am extremely pleased to be able to participate at the 73rd World Health Assembly. It is an event every year, but this year it has an extraordinary importance given the very unprecedented situations that humanity faces. This should be a moment for renewing our organization, and that we renew our strong commitment to the organization. Spain believes firmly that the only response to COVID-19 is a multilateral one. This pandemic has highlighted our vulnerability and made it clear that we need one another. That's why, more than ever, we must be united, because united, without any doubt, we are stronger in the face of COVID-19. In 1948, our leaders set up the World Health Organization, and now, 72 years later, today's leaders, we must give it the tools to strengthen its leadership. We have learnt many lessons through this COVID-19 crisis. Unfortunately, it has been forced on us, and with a major cost on a human and emotional level, with the irreplaceable loss of many of our compatriots. And I would like to pay homage to the victims of this illness, of this pandemic, and express my condolences to their families and friends. So I support the World Health Organization and Dr. Tedros so that they leader and build on these lessons learnt, so that they can help us to be better prepared to future challenges. We have to work with an integrated vision which looks at the multi-sectoral spheres of health, so that we can reach the third Sustainable Development Goal that Spain is committed to promote the well-being of all in all ages. For Spain, universal health coverage is the keystone for having effective, resilient and quality healthcare systems which respond to health emergencies, but also for the permanent protection of health. Director General, Spain trusts that the WHO will continue to play its leadership role, and we are convinced that if we work together, we will be able to emerge stronger from this crisis. Thank you.
Je vous remercie, Excellence.
Thank you very much, Your Excellency. I invite His Excellency, Mr. Giuseppe Conte, the President of Ministers of Italy, to take the floor.
Madam President, Mr. Director General, Excellencies, this 73rd World Health Assembly comes at a crucial time, in the middle of our fight against the threat of the COVID-19 pandemic. The virus has changed our lives in ways that we never could imagine only a few months ago. We are living an unprecedented global crisis, a crisis that knows no borders and spares no region. We can only overcome it all together through solidarity, cooperation, and mutual accountability. From the very beginning of the pandemic, Italy has promoted the strengthening of global leadership and international solidarity to manage the emergency and accelerate long-term, sustainable solutions guided by science, research, and medicine. The outcome of this assembly displays the value of our cooperation and establishes a framework for an effective response. Let's face it, we were not entirely prepared for such a huge global crisis. We have shown great resilience, but now we are called to learn our lessons, and for sure we have lessons to learn. We have to strengthen early warning mechanism, exchange of information, identification of best practice to improve the international community's pandemic preparedness. Since Italy's first call for an international alliance to fight COVID-19, together with the WHO, global health actors and key partner countries, we have launched the ACT Tools Accelerator, a global platform to speed up efforts for vaccine, therapeutics, and diagnostics tools and ensure universal and equitable access to these life-saving treatments. We should leave no one behind. As a country committed to effective multilateralism, Italy believes that we should enhance our global health architecture, including by strengthening the role of the WHO. Just a few months ago, we commemorated the 40th anniversary of smallpox eradication, to which WHO's contribution was decisive. We commend the organization's long-standing work to safeguard people's health, often carried out under very difficult circumstances. Global health has been a consistent, permanent priority for my country, especially in the framework of international development cooperation. And this crisis risks to derail the historic global goals achieved so far in the health sector and to disrupt our pathway toward SDG 3 and the whole 2030 agenda, especially in Africa. Therefore, Italy believes that increasing our support to the most vulnerable countries much needed, and be reassured that Italy will take the opportunity to promote the common goals of a global health high in the agenda of its upcoming presidency of the G20 in 2021. Italy has been one of the first and most severely hit countries by this pandemic. In March, we remember very well, we needed to take drastic measures to contain the spread of the virus. After 2 months, epidemiological data are encouraging. They confirm that our collective efforts and sacrifices have paid off. We are now easing most restrictions, yet keeping rigorous safety measures for every social and commercial activity. We continue to strengthen our health infrastructure, increasing intensive care units and hiring doctors and health workers. We have broadened testing and developed a nationwide monitoring plan in synergy with our local authorities. We are entering the phase 2 with cautious optimism and a sense of responsibility. We know that our struggle is far from being over. To that end, we still need each other. Global health is our shared priority and must be our shared responsibility. Today, more than ever, we believe that together we will make it. Thank you.
Thank you very much, Excellency. It is my pleasure to now invite the Prime Minister of Tuvalu, His Excellency Kausea Natano. You have the floor, Excellency.
Madam President, Director General, Excellencies, it is indeed an honor for me, as Prime Minister of Tuvalu and Chairman of the Pacific Island Forum, to deliver this message during the closing of the 71st session of the World Health Assembly. Let me begin by expressing my condolences to the families of those who lost their loved ones. I would also like to take this opportunity to salute health workers around the world who are working tirelessly to treat and protect us from this virus. Tuvalu remains COVID-19 free, but that does not mean that our preparedness and response planning efforts are lesser than the countries that confirm cases of the virus. In fact, it is a testament that we have been preparing and responding effectively since January. Our world faces unprecedented crisis like no other. The COVID-19 pandemic is both a global health emergency and a human crisis that impacts our livelihoods and deepens mistrust around the world. During this pandemic, we are learning that the virus does not respect national borders. We are all vulnerable, and that shared vulnerability reveals our common humanity. We therefore fully support the WHO extends an invitation to include Taiwan to be part of the WHA. In order to respond to COVID-19 pandemic, Tuvalu and other Pacific Island countries invoked the Pikadawa Declaration that emphasizes a regional approach. This has allowed for the establishment of the Pacific humanitarian pathway that facilitates a swift and effective delivery of medical supplies, equipment, and personnel to our member countries. Excellencies and distinguished delegates, global and regional crises of this kind remind us of the importance of collective efforts and giving a helping hand to others. So my plea to the world community, let us all leave our differences aside and work together to eliminate this virus from the surface of the earth. COVID-19 has made us all vulnerable, and it has also reaffirmed the 2030 Agenda and the Paris Agreement as essential global commitment to strengthen and enhance our resilience. Our commitment to COVID-19 is born out of the belief that multilateralism and regional cooperation remains the best way of addressing our common crisis of pandemics and climates. I know that you had fruitful outcome in your deliberation, and I would like to conclude by wishing you all the best, and God bless you all. Tuvalu Motetu.
Thank you very much, Excellency. We have a small technical issue with Vietnam. We are waiting for His Excellency Nguyen Xuan Phuc, the Prime Minister of the Socialist Republic of Vietnam. In the meantime, I will give the floor to Her Excellency, Mrs. Ursula von der Leyen, President of the European Commission. You have the floor, Excellency.
Dear Director General Dr. Tedros, dear friends of the World Health Organization, in the last 3 months we all have seen how crucial it is to join forces for our individual and collective health. Only 2 weeks after the first coronavirus outbreak, laboratories across the world, from South Korea to Germany, were able to work on the full sequence of the coronavirus genome. And in a matter of days, they developed a test for the virus. That was possible because of the share of information on a global scale. In times of a global pandemic, international cooperation should be a no-brainer. Now is the time to act. We need to fight and defeat coronavirus in all continents. We need tests, medicines, and a vaccine, and we need them to be affordable for all. Last month, you called on all nations to join forces so that a cure and a vaccine could not only be developed but distributed all across the world. The European Union responded immediately. We hosted a virtual pledging conference, raising $8 billion. We put Europe's convening power at the service of the United Nations system and of all humankind. This will accelerate the development of much-needed vaccines and therapeutics, and we will see to it that once developed, they can be deployed universally and be available to all. A coronavirus vaccine should not be a luxury for chosen few, but a universal common good. Let me thank the co-sponsors and all of you for our good cooperation. In times like these, the greatest act of courage is to play as a team. This does not mean that once the dust will have settled and once we have delivered on our pledge to beat this virus, we should not look into ways to modernize the WHO, to see what should be done for the WHO to continue to live up to the new challenges. Because we need multilateral approaches. But let us for now focus on our most immediate challenge. This is the time for cooperation. This is the time for science and solidarity. This is the time for all humanity to rally around a common cause, and you can count on Europe to always play for the team.
Merci beaucoup, Madame la Présidente.
Thank you very much. As I understand it, we still have a small technical difficulty trying to connect with Vietnam. We're going to show a video for a while we try and get our connection with Vietnam up and running. If I could just ask you to be patient. Thank you.
thank you very much for your patience. It seems that now we are, sorry. Thank you very much for your patience. In order to save your time, we're going now to go to the right of reply, and I will hand the floor back to you, Madam President, and we will come back to Vietnam as soon as possible. Thank you very much.
Thank you, Madam. In order to move along, it is being proposed that we proceed to the rights of reply. I'm advised that there are 4 delegations requesting rights of reply: the Russian Federation, China, Cuba, and the United States of America. However, before I give the floor to the delegations in the order I just listed, I would like to remind delegates of what I would have conveyed last evening. May I kindly request that in delivering a right of reply, delegations be as brief as possible, taking into account that at this meeting, interventions themselves are limited to 2 minutes. If delegations could kindly interpret the word brief relative to the time allotted for interventions themselves, it would be greatly appreciated. And finally, if there are subsequent requests by delegations for additional spoken rights of reply concerning the same matter as previous replies, may I kindly request delegations to limit such spoken statements to 30 seconds or less. I hope delegations will understand that these requests are made in our common interests in the good order of our proceedings and to help us move things along. I now give the floor to the Russian Federation. You now have the floor. Please proceed.
Thank you, Chairman. Chairman, ladies and gentlemen, unfortunately, we were not expecting this kind of a statement by the Ukrainian delegation. The interpreter apologizes. This is inaudible. Apologies from the interpreter, Chairman.
Madam Speaker, excuse me, the delegate of... Hello? Thank you, the delegate from the Russian Federation. My apologies for interrupting. I'm advised that they're having some difficulties with the audio. Give me...
Do you want me to start again?
One moment, please. The distinguished delegate from the Russian Federation, I'm advised that apparently they're hearing an echo. There may be a speaker in the room, and they're asking if you might perhaps turn it down or turn it off, and that would help with the audio. Could you please do that, and then we will proceed with your
Мы
intervention.
попытались корректировать звук, господин председатель.
Sorry, the delegate said something about the sound, but the interpreter doesn't know what. Can you hear me?
We can hear you, but I understand they're getting an echo. If there is a speaker on, can you please turn it off and then proceed with your intervention?
Сейчас по-прежнему.
Is that any better?
Saying that's much better. Can you please proceed?
Начинаю. Благодарю вас, господин.
Thank you, Chairman. Our delegation has taken the floor in order to react to what was said by the delegation of Ukraine. Unfortunately, we did not expect to hear this kind of a statement. We thought we were discussing controlling and fighting the virus. Unfortunately, Ukraine appears to be trying to put the responsibility for the failures of the Ukrainian authorities onto other countries. I'm sorry, Chairman. I really am, but I can't do this. I can't hear it. Thank you.
My apologies again. My apologies again, Honorable Delegate from the Russian Federation. I understand from the interpreters that they are still having a difficulty hearing you. I'm advised that we'll have to come back to you. We'll come back to you. We'll come back to you. We'll give the floor to the other speakers, and then we'll come back to you. I will now give the floor to China. The Honorable Delegate from China, you have the floor, please.
Thank you, Madam Chair. I'm sorry, we cannot hear the Chinese speaker. Thank you, Madam Chair. The unanimous decision of the Virtual Assembly is not to consider Taiwan-related proposals, which fully reflects the clear stand of the international community and the WHO in affirming the One China principle. However, there are still a few countries determined to plead for the Taiwan authorities, seriously violating relevant UN and WHO resolutions, and undermining global anti-epidemic efforts. China solemnly protests and firmly opposes this behavior. It's been proven the so-called gap in the international epidemic prevention in Taiwan is a purely political pretext, which is doomed to fail. Madam Chair, the virus is still raging. In this context, our top priority is to unite and cooperate to save lives and continuously support the WHO's leading role. We hope that some countries can step up cooperation with the international community in a responsible manner so as to jointly defeat the pandemic. Thank you, Madam President.
Thank you, distinguished delegate from China. I now give the floor to the distinguished delegate from Cuba.
Sí, bien. Gracias, señor.
Thank you, Madam Chair. In its reply yesterday, the delegation of the United States deliberately, dishonestly, the government exaggerates the figures that it is declaring for the licenses for the export to Cuba, and they have nothing to do with the requests made by our country for requirements for importation, nor with the trade transactions in reality. The blockade dates 60 years now. In the area of health, it has led to more than $3 billion. Acquiring medical equipment and supplies in a regular manner have to be acquired from far away, or we have to do without them when serving the health of the people of Cuba. It is untrue to say that in this period, with this administration that has cruelly intensified these restrictive measures, the blockade, in accordance with the Convention Against Genocide, is a genocidal act. They should follow the United Nations and the calls to remove the measures against countries such as Cuba, but it has fallen on deaf ears until now. Finally, the interpreter apologizes. The sound is causing difficulties. The interpreter apologizes.
Thank you. I will now give the floor to the distinguished delegate from the United States of America. You have the floor. Is the United States connected, please?
Thank you, Madam President. Under item 3, at the President's suggestion, the United States has submitted a written explanation of position regarding the COVID-19 response resolution. However, in reaction to the unhelpful explanation of positions delivered by Iran, Syria, and Cuba, which were far from the spirit of solidarity, the United States will exercise its right of reply. The United States has and continues to offer humanitarian assistance to the Iranian, Syrian, and many other people, including Cubans, to help address the coronavirus outbreak. The United States maintains broad authorizations that allow for the sale of food, agricultural commodities, medicine, and medical devices by U.S. persons or from the United States to Iran, Syria, and many other places. Similar exceptions apply for foreign persons providing aid. Our sanctions are not an obstacle to providing humanitarian aid to Iran or other countries. As Secretary of State Pompeo noted in his March 31st remarks to the press, with respect to the goods needed for countries to resolve the coronavirus problem, they were not sanctioned, they are not sanctioned, and they will not be sanctioned. And finally, in reaction to the statement by China, we join countless others in the international community who today have called on the WHO to extend an invitation to Taiwan to the WHA. Thank you, Madam President.
Thank you. I will return the floor to the Russian Federation to see if the audio is a bit better now. Madam, you have the floor.
Thank you, Chairman. We took the floor, as I said, in order to use our right to reply relating to the statement which was made previously by the delegation of Ukraine. Unfortunately, we didn't actually expect such a statement because it was somewhat distant from the basic topic we were discussing, the fight against the coronavirus. It didn't seem to have much to do with that. It was more a question of transferring the responsibility of the failure of the actions of the Ukrainian authorities onto somebody else's shoulders. I'm sorry, Chairman. According to the statement of the Ukrainian delegation, from what we see of it, it's simply an act of provocation and an attempt to bring political issues onto the agenda of the Assembly. This is destructive behavior and it's not acceptable. We would like to say that the Russian Federation is ready for fruitful and direct cooperation with the organization and its member states on issues within its remit. Thank you.
I understand from the Secretariat we have further requests from the floor. Requests for reply. I give the floor to the distinguished delegate from Ukraine.
Thank you, Madam President. First of all, I would like to draw attention the Russian delegation that the main statement of the delegation of Ukraine, covering in particular the response to the COVID-19 pandemic, according to the provided by the WHO Secretariat options yesterday, was posted on the official WHA website. I, of course, strongly reject some Russian false and misleading narratives concerning the developments in my country. In my previous statement on the agenda item 6, I have not politicized at all the work of the 73rd WHA. I have made points which have direct relevance to the WHO mandate, healthcare and humanitarian fields. Russia must provide the WHO the objective picture and real relevant data about the situation on the temporary occupied territories of Ukraine. I call on the Russian Federation to provide full and comprehensive access for the ICRC representatives, international humanitarian agencies, as well as medical workers to the population of the temporary occupied territories of Ukraine to deliver qualified medical examination, treatment, and humanitarian assistance. Russia must fully guarantee the right to life and access to health care for illegally detained Ukrainians. I thank you, Madam President.
I thank the distinguished delegate from Ukraine. I now give the floor to the distinguished delegate of Syria. You now have the floor.
Hello?
The distinguished delegate from Syria, you have the floor now.
Hello? Yes.
Please proceed, sir.
Thank you, Madam President. I find myself obliged to take the floor to respond to the comments just made by the representative of the United States regarding unilateral economic measures imposed on my country, as well as on other countries, and their repercussions on national efforts to effectively cope with the challenges posed by COVID-19. The reference to the so-called humanitarian exemptions of those sanctions is in fact no more than a pretext to justify the imposition of those unilateral measures. I would like to invite the distinguished delegate from the US and other colleagues to revert to a report of the rapporteur of UCMs in the Human Rights Council about his visit to Syria in 2018, where he raised the issue of the humanitarian exemptions and confirmed that these are in fact non-existent. And in fact, we believe that the best service the US could do for the humanitarian situation in Syria starts by lifting those unjustified and immoral sanctions rather than seeking to impose new packages of sanctions while we are in the midst of facing COVID-19 challenge and its accompanying repercussions. Thank you, Madam President.
I'd like to thank the distinguished delegate. I understand that the Honorable Delegate of China wishes to take the floor to exercise a further right of reply. I wish to remind delegates that in the event of a sequence of rights of reply between member states, each replying to the other, the practice in the WHO and in other UN organizations is to allow each member state two intervening, or should I say additional interventions, thank you, I'm being corrected by the Secretariat. They allowed two interventions in the exercise of rights of reply. In this way, such sequences can be managed fairly and transparently without unduly disrupting the meeting. Furthermore, I would like to remind delegations of my request yesterday, and I think earlier today, that any subsequent requests for additional interventions in the exercise of the right of reply concerning the same matter should kindly be limited to 30 seconds or less. Accordingly, I now give the floor to the Honorable Delegate of China to exercise a second right of reply. So you have the floor.
Thank you, Madam Chair. This video conference unanimously decided not to examine the issue of Taiwan so that to guarantee the smooth running of the meeting. However, just now, the US delegate is still doing political hype. This conduct is not acceptable. China firmly opposed to it. Thank you, Madam Chair.
Thank you, and that concludes the rights of reply. And I understand, I'm reminded that we still have to have the statement from Vietnam. I turn the floor over to Madam Bokos. I'm going to get it right. Just bear with me.
Thank you very much indeed, Madam President. Thank you. Indeed, we now have one more statement. Accueillons donc à présent.
His Excellency Nguyen Quan Phuc, Prime Minister of the Socialist Republic of Vietnam. Your Excellency, the floor is yours.
Madam President, Mr. Director General, ladies and gentlemen, I'm honored to speak at the 73rd WHA. At the outset, allow me to express my sincere sympathy to the governments and peoples around the world for the immense losses caused by the COVID-19 pandemic. I would also like to extend my appreciation to the health workers, medical personnel, and WHO staff who are selflessly engaged in the valiant fight against the pandemic to protect the health and well-being of all. Ladies and gentlemen, this year's WHA is particularly significant. It takes place amid a pandemic that exerts unprecedentedly far-reaching impacts on all countries. More than ever before, all countries need to strengthen international solidarity and support multilateral cooperation, in particularly the UN and the WHO. As the leading global health organization, WHO should continue offering countries scientific expertise, fostering collaboration and mutual understanding, coordinating international efforts, mobilizing common resources so as to respond to the pandemic effectively. Protecting its people's health and lives is a top duty of every state. We must proactively strengthen the preparedness and resilience of our healthcare system, step up international cooperation, and enhance information and experience exchange. In the fight against the pandemic, we must ensure that everyone in every country and territory have access to vaccine and medication. I should stress the WHO and developed countries should also continue providing practical assistance to developing countries in this endeavor. Alongside the efforts to address the immense consequences of the virus, we need a post-COVID-19 development plan that provides support for businesses to resume, ensuring social welfare for citizens, especially the poor and the vulnerable, so that no one is left behind. We need to strengthen cooperation to sustain the supply chain, sustain international economic connectivity and financial market stability. Ensuring a peaceful environment is thus crucial for these tasks. Ladies and gentlemen, conscious of the danger of the pandemic from early on, Vietnam has fought the pandemic as though an enemy. We adopted the whole government approach, where the healthcare system, scientists, and the armed forces all join in implementing quarantine measures, combining contagion control, contact tracing and testing, and treatment. The government accepted short-term economic losses in order to safeguard the public health and safety. These policies and measures have been well supported by the public. As of today, Vietnam, a nation of nearly 100 million people, deeply integrated into the region and the world, only records more than 320 cases with 0 fatality. Today is the 33rd day without community spread in our country. Having essentially kept the pandemic under control, Vietnam is moving on to a new normal, engaging in economic recovery and development, while never allowing complacency in fighting the disease. In the spirit of cooperation and sharing in times of hardship, the government, businesses, and people of Vietnam have provided timely and practical assistance including made in Vietnam masks and medical equipment, and shared our experience with various countries, especially countries heavily affected by the virus. At the same time, Vietnam has made financial contributions, although modest, to the WHO's COVID-19 response fund as the 2020 ASEAN chair and a non-permanent member of the UN Security Council for the term 2020-2021. Vietnam has hosted and joined numerous discussions and efforts towards a common voice, put forth initiatives to promote collective actions in combating the pandemic, offering assistance to the people, and promoting post-pandemic economic recovery. Vietnam is confident that in face of the most serious challenge in the founding,
Việt Nam tin tưởng rằng trước thách thức nghiêm trọng nhất kể từ khi thành lập Liên Hợp Quốc và cái thế giới này, cộng đồng quốc tế sẽ tiếp tục phát huy ý chí và sức mạnh của mỗi dân tộc, cũng như tinh thần đoàn kết, hợp tác quốc tế mạnh mẽ để cùng vượt qua, cùng xây dựng một tương lai tốt đẹp hơn cho một quốc gia và một người dân.
Thank you very much, Your Excellency, for your intervention. This concludes our list of high-level guests. Let me thank them all again for their participation. I now hand the floor back to you, Madam President.
Thank you. Finally, I invite the Health Assembly to consider the proposed decision contained in documents A73/34 on suspending the 73rd World Health Assembly until a resumed session later in 2020. Does the Health Assembly accept this proposal? I understand that in the absence of any request to take the floor, I will consider that the Health Assembly agrees to adopt the decision. The decision is hereby adopted. Honorable delegates, this completes our consideration of the agenda items. At this time, I would now like to invite Dr. Tedros for any final remarks. So you have the floor.
I'm from Bahama. Thank you, Madam President. President Duque Marquez of Colombia, President Benitez of Paraguay, Prime Minister Shering of Bhutan, Prime Minister Pedro Sanchez of Spain, Prime Minister Conte of Italy, Prime Minister Natano of Tuvalu, Prime Minister New Senfo of Vietnam, and President von der Leyen of the European Commission, Excellencies, my dear colleagues and friends. Last year, I had the honor of visiting several islands in the Pacific, including Fiji, Tahiti, Tuvalu, and Tonga, where I was welcomed by a choir of nurses. When we originally planned this year's World Health Assembly, we invited that choir from Tonga, choir of nurses and midwives, to perform and to mark the International Year of the Nurse and the Midwife. COVID-19 has deprived us of that privilege. But today, I'm wearing this shirt from Tonga, which I got actually from the minister, as a gesture of thanks and solidarity with our friends from the Pacific. Of course, our president is from the Bahamas, and I think because of the cultural similarities, my shirt also represents the Caribbean. So I'd like to dedicate my closing speech, actually, to the choirs that we were expecting to join us from Tonga. And you might know, during my visit, I was even given a Tongan name. And my Tongan name is Vai Toi Moyu Mapavia. So this is a typical Tongan name, and so honored to have a Tongan name. But to my Tongan friends and the rest of the Pacific, we hope you will be able to join us at the next year's assembly and do what we plan to do. And now, to the rest of my speech, I offer my deep thanks to the many member states who have expressed their support and solidarity at this assembly and throughout the pandemic. I have been impressed and inspired by the commitment of so many countries to fighting the virus and saving lives. I also thank the regional directors for their messages, which were played last night, and for their continuing efforts to support countries. I thank member states for adopting the resolution which calls for an independent and comprehensive evaluation of the international response, including but not limited to WHO's performance. As I said yesterday, I will initiate such an evaluation at the earliest appropriate moment. We welcome any initiative to strengthen global health security and to strengthen WHO and to be better safe. As always, WHO remains fully committed to transparency, accountability, and continuous improvement. We want accountability more than anyone. And I thank Dr. Felicity Harvey and the members of the Independent Oversight Advisory Committee for their continuous work to review WHO's work in health emergencies, and in particular for their report on the COVID-19 response published yesterday that covers from the start of the outbreak until the start of the pandemic until April. So checking and learning our lessons is in WHO's DNA. And that's what this report shows. And I hope the recommendations of the independent committee will be taken seriously by our member states. And some of the recommendations are to WHO, and we will take our share also seriously. WHO's focus now is fighting the pandemic with every tool at our disposal. Our focus is on saving lives. At the end of the day, what matters is life. That should be at the center of everything we do and everything we say. I have been heartened by the way countries have shared experiences and best practices through our regular member state briefings and at this assembly. We will continue providing strategic leadership to coordinate the global response and support the efforts by the countries. We will continue providing the world with epidemiological information and analysis. We will continue to keep the world informed and give people and communities the information they need to keep themselves and each other safe. We will continue shipping diagnostics, personal protective equipment, and other medical supplies all over the world. We will continue bringing together leading experts from around the world to develop technical advice based on the best science. We will continue driving research and development to develop evidence about vaccines, diagnostics, and therapeutics. We will continue working with countries and all relevant partners to ensure equitable access to the tools to prevent, detect, and treat COVID-19. We will continue supporting countries to prepare and respond. And we will continue working with countries to sustain essential health services. We will continue to work day and night to support the most vulnerable countries and populations. We will continue supporting countries to achieve the 3 billion targets and the Sustainable Development Goals. And we will continue supporting countries to build resilient health systems based on primary health care to progress towards our shared goal of universal health coverage. My brothers and sisters, dear colleagues and friends, COVID-19 has robbed us of people we love. It has robbed us of lives and livelihoods. It has shaken the foundations of our world. It threatens to tear at the fabric of international cooperation. But it has also reminded us that for all our differences, we are one human race. And we are stronger together. We may speak different languages, but we share the same DNA. We may adhere to different phases, but we share the same aspirations for a peaceful and harmonious world. From east to west, north to south, everybody wants peace and development and health. Nothing else. That's what human beings want. That's what humanity wants. We may have different cultures and traditions, but we share the same planet. For everything COVID-19 has taken from us, it has also given us something, a reminder of what really matters, and the opportunity to forge a common future. Dark and difficult days may lie ahead, but guided by science together, we will overcome. Let hope be the antidote to fear. Let solidarity be the antidote to division. Let our shared humanity be the antidote to our shared threat. Now, more than ever, thank you. Shishe. Merci beaucoup. Spasiba. Muchas gracias. And to our Muslim brothers and sisters who are fasting, shukran jazilan, and we wish you Eid Mubarak. Thank you so much. Together we will overcome this challenge. Nothing will be difficult to address when the human spirit wills it. I thank you. And thank you. Thank you for joining us. Thank you for your support. Thank you. Thank you for the success of the Assembly. Thank you so much. Thank you. Thank you.
I would like to thank Dr. Tedros for his remarks. Thank you, sir. We've had a very eventful 2 days, and I will now make some brief closing remarks. Director General Dr. Tedros, honorable ministers, heads of delegation, ladies and gentlemen, it is a distinct honor for my country, the Commonwealth of the Bahamas, and a privilege for me personally to have served as your president for the 73rd Assembly during the past 2 days. Allow me to congratulate you all on a truly historic assembly that has been exceptional in so many ways. The COVID-19 pandemic has necessitated, for the first time, the virtual meeting of this assembly. Your physical absence from the meeting hall and the number of speakers who addressed the assembly speak volumes to the far-reaching impacts of this disease. As president, I am proud of every delegation for your flexibility, patience, and resolve as we all stayed the course, working together in new ways. I am overwhelmed and heartened by your support. I am so proud of how each and every one of you conducted yourselves in this virtual environment and expressed their sincere passion to strive for a healthier, safer, and more resilient world. As we suspend this assembly, we know the huge challenge that faces us all and the looming threat of complacency. We must remain vigilant. Indeed, the public health community has overcome challenges in the past, and we can and we will do it again, but we must continue to work together, supporting neighbors and sharing resources in the spirit of solidarity and global community. Vice Presidents, thank you for your support in guiding this assembly. His Excellency, Mr. Li Song, People's Republic of China, Mrs. Jacqueline Lydia Mukulu, Congo, Mr. Roberto Shavata, San Marino, Dr. Akamram Eltoum, Sudan, Dr. Viraj Tenchiraro and Satyam. I think I got it right, but if I didn't, no slight intended, but thank you. The good doctors from Thailand, I must thank the interpreters. They did a phenomenal job. Thank you.
You're welcome, Chairman. Thank you.
Without you, we could not be one united team working together, understanding the concerns of each member state that made an intervention. All WHO staff, thank you to all who have worked tirelessly to prepare for and support this assembly, including governing bodies, legal, conference services, and the IT staff, for your extraordinary efforts this year to connect us with our colleagues from around the world. I would also like to thank the WHO staff in regional and country offices for your extraordinary engagement for this year's assembly. Honorable delegations, thank you for your hard work, your patience, your cooperation. I wish you continued strength in your efforts to respond to COVID-19. Dr. Tedros, my deepest appreciation for your steadfast leadership in these unprecedented times. I look forward to seeing you all soon and hopefully meeting you in person at the resumed session of the Assembly later this year. I now formally declare the 73rd World Health Assembly suspended.
So, Madam President, this is for your wonderful leadership. And with respect and appreciation from myself and the whole staff here. Thank you so much.
Thank you.
Thank you. Yeah, and this one, WHO, again, with appreciation and respect.
Thank you, sir.
Thank you.
Thank you very, very much for all your support.
We can't,
I couldn't do it without your support.
I have to say, it was so nice to visit.
Thank you.